But the thing that I wanted to talk about today is what happens when we don't center weight. This is a conversation that's about thinking different ways that we can prioritize our health that doesn't have to do with a number on the scale. So thank you so much for everyone that's jumping on live. If you can hear it, Penny Denny has heard us. Penny Dina has heard us. So she is in here now. So you will probably get my co-star over here, Miss Penny Dina, my dog. She'll normally be quiet, but just in case she isn't, you'll hear a little bit of tambourine ministry from her. But I wanted to jump in here and have this conversation because there's three things that I think can be really helpful for people to consider what happens when we don't center weight, meaning that what other options do we have? And one of the big things that I think is very important to consider, and maybe I should actually introduce ourselves just in case y'all new to us. We are the EVWH community, and we're really passionate about supporting you to be able to have a more informed decision when it comes to your health. So we're about providing education and training that's around nutrition, around fitness, around different components of health. So back to what we're talking about what happens when we don't center weight. One of the things that's really powerful is when we don't center weight, that we can actually center the individual over stigma. And what I mean by this is when we center the individual in the conversation, you're really thinking about what actually works best for that individual, what actually is supportive to their health. And I'll give you a tangible example. So I have my little notes here. So if I look down, it's because of that. Is one of the people that I thought about is a client I used to work with, Veronica. And Veronica was someone, me and her both served in the United States Marine Corps together. So when it comes to like fitness, this is not something she's ever really struggled with. We both have that training background. But when it came to nutrition, she was really struggling with how to kind of eat that's not super focused on diet and restriction. So when we started working together, she was also pregnant. And I use all of this as an example because when you think about the individual, you're taking into account all of the factors that make up the person, right? It's not just about here's a plan, here's a template, do this thing. So with Veronica, one of the things that we really worked and focused on was the fact that she lived at that point on a farm with her husband. And the second thing is that she worked at a grocery store. So when we're thinking about different recipes, it didn't make sense to be like plan all these things that you have to like ship. And this is a couple of years ago too. So it wasn't like Amazon Fresh was a thing back then. And once again, she lives on a farm. So like there ain't no Amazon Fresh. So therefore we were looking at like, what are things that she can get from her farm? What are things that can get from the grocery store where she lived? So when you think about the individual, you're taking into account what is realistic for yourself. So for instance, yes, maybe you have access to like a community garden. So yeah, you can pick your vegetables there. But if you're someone like me well, actually I do have access to a community garden. I'm just not a gardener. So if you're someone like me who's not really into gardening, it makes more sense for me to go to the grocery store to buy the fruits and vegetables that I need. And when I'm there buying the fruits and vegetables that I need, I also want to sit there and make sure that I'm looking at things that I can prepare in a week that aren't going to go bad quickly, right? So I'm thinking about things that I'm going to get the most bang for my buck, right? So those are just things you want to consider as the individual, rather than saying this is the perfect template and you need to grow all your foods, or you need to only eat organic, or you need to do wild caught and grass fed. Like, make eating nutritionally easy for yourself. Make it simple, make it doable, because guess what? You can expand and do things as you become more comfortable with the practice. You can expand and do things differently, but start off with the simple parts so that you can actually build those habits and build the behaviors. And then if you want to add in all the extra stuff, do you, boo. So that's the first thing I want to make sure we touch upon. The second thing I want to make sure we touch upon is like, we center the facts over the assumptions. So what I mean by this is it's really discouraging for some people when they're hearing all of this information and all of these theories, instead of thinking about what are the facts and how are these facts relevant to you. I'm going to use another example. So I also had someone I used to work with named Julia. And one of the things that Julia was an older woman. So she comes from the generation of people who really did cook and grow their own foods, right? And one of the things that she actually struggled with is she also had a different chronic conditions. I have chronic conditions as well. So one of the things that she really struggled with was trying to be able to figure out like, what are the foods that I eat? How much do I exercise? Like, she had all this information coming from her doctors who didn't necessarily look like her. She's still alive. She's an older Black woman. She worked with a lot of people who were younger, white physicians, right? So these were people that she didn't necessarily connect to. They didn't necessarily understand some of our cultural traditions in the Black community. So it was very much, she felt very discouraged often when they would be like, you need to avoid this and eat that. So one of the things that we started working together on is around not just like helping her meal plan and prep, we did do that, but it was really around helping her kind of reframe what health looked like for her and understanding that some of the challenges that she was experiencing wasn't that she wasn't doing things right, is that she was trying to fit someone else's lifestyle, someone else's ideas of what health looked like, someone else's food traditions into her life. And it was so difficult for her and her husband to make those changes and navigate those waters. So that's why I often encourage people, like, start with where you are, and then you can think about expanding to do things differently. And for her, it really came down to, she had a lot of beliefs around her value and her importance. And when she kind of got to the core of understanding that she was valuable and she was in without being less, how do I say this? I'm trying to make sure I say it in the way that I want to be like mindful for her lived experience. But she needed to really understand that her value didn't come into like how perfect she was, which can be something that most people resonate with when you think about when people try to do certain diets or certain exercise routines. Yes, it goes to like following rules, but some of us struggle really with that perfectionist system. And we feel like if we can't do everything perfectly, if we can't count all the calories and track all the macros, if we can't eat organic, if we can't exercise this many times a day, then we're not going to do any of it at all. And I want people to feel less needing to do all of that. Like, there's going to be seasons of your life where you might have the energy to prep all your meals. You might have the energy to go on walks every single day, but there's going to be seasons of your life where that ain't possible. And you're going to get one thing done that week, not even that day. And that's going to be good enough. So I really want people to feel encouraged to do good enough. And that's why it's important when we said that the first point, thinking about what works for you as an individual. The second point is, what are really the facts, not the assumptions, not the things that happen on a perfect day, but like, what are the facts? What are the things that are doable for me? And then the third point I want to make sure we talk about is like, we center trust over compliance. And I say this because I know, luckily, in the health field, they're moving away from the terminology of like compliance on like patient records and things, which is a big thing for me, because as a patient with multiple autoimmune conditions, I'm unapologetic about challenging my doctors, not because of the fact I want to be difficult, but because I want to make sure that the information that they're providing me, the recommendations that they're providing, are really relevant for me as a woman, me as a Black woman, me as a person with multiple autoimmune conditions. Like, I always want to make sure that it makes sense, like make it make sense for me. So when we think about building that trust, and especially for many of you who are working with different providers, whether you're working with, your physician, your clinicians, trainers, coaches, you really want to build that trust, because to be honest, if you don't really trust them, you're not going to apply any of their recommendations anyway. And it's going to be like you wasting your time and your money. So I always want to sit there and think about, when we're building that trust, I will bring it to another example of a client that I work with. And I wanted to give y'all examples, so I'm like thinking through them. So I write notes also, so I don't go on tangents. But I think about a client I work with, Sheena, and Sheena was different than the other two clients I mentioned earlier, because Sheena is an entrepreneur and she's like building her business. She's a tech entrepreneur. When we worked together, she was just building her organization. Now it's a lot bigger now. But I use her as an example because with her, she is actually a very extremely, when y'all say y'all are busy, she is like, literally, this woman is booked and busy all the way, all the time. So she was not a person who's like going to prepare all her foods. She's a person who needs to outsource that. So when we started working together, I was really helping Sheena understand, like, okay, you have breakfast meetings, lunch meetings, dinner meetings, like you ain't home to cook none of your stuff. So she was like, how do I like maintain this nutrient dense philosophy, like eat health promoting foods, because I have to go to these breakfasts. She's with investors all the time. So we kind of worked around like, hey, let's see how you can kind of have a basic template of like go-to meals, go-to restaurants. We live in the Boston area, so a lot of her meals were in the area. So I was like, hey, just, make suggestions to say, hey, let's eat at this place. When you're, look at the menu ahead of time so you feel comfortable with the choices that you're making. And it wasn't because she was trying to be restrictive. It was based on the reality that she just needed to manage her energy, right? So it's like, she was like, I need to eat things that are going to keep me energized, because I got to go from meeting to meeting, investor to investor. she, like me, has chronic conditions. So like she doesn't want to deal with brain fog. That's the worst thing, is when your like brain goes blank and you're like, goodness, I have to talk to this person and I don't even know. Henceforth, why y'all see me with all these notes. But I used her as an example when you think about centering that trust, is because her and I had built that trust over a number of years. We were able to have a conversation and she was able to kind of not only like hear my recommendations, but trust that I was really listening to her, understanding her unique circumstances, and being able to support that. And I see someone's live. Yes, ma'am. Second that. As a nurse and practitioner, advocate, act as a team approach. Thank you so much for saying that, Roz. I agree. It's just one of those things where advocacy is so important when you're thinking about working with a provider, because like you said, it is a team approach. And I think sometimes, and I know, and I understand it too, as a person with like multiple autoimmune conditions, is that sometimes patients can go into it thinking like, this person isn't going to listen to me, or this, because they've had negative experiences before. And I understand that there's a reason to kind of be a little bit mistrustful of people at first. But I also say, if this is a person that's a provider and you truly do want to improve when it comes to your health, it's about building those bridges. And that happens on both sides. It happens on the practitioner side of like making sure you build that rapport, but also happens on the patient side and the client side of being like, you have to be open to the possibility that they will listen. And even if they do push back again, ask more clarifying questions, don't be going to it defensive. Something that I do is like when I'm working with a new doctor, especially, and they give that question, do you have any questions? And I really don't. I just say, well, if you were me, what questions would you be asking? And that's a way for them to kind of like, one, it takes them off guard because they're like, oh, that's a good point. Like, what questions should be asked? And then it just helps build that rapport. So definitely agree that you want to build that relationship with people and just understand that it is a process of building trust. And it's also a process where you can also lose trust. So you always want to be mindful on both sides of, if you're the practitioner, you want to make sure that you're being completely honest about the treatment plan so that the person feels comfortable. If like my doctors on some of my conditions, they're like, we just don't know what's next to Misha when it comes to you. We're at the management stage. We're not at really, there's no cure. So in those instances, I like the fact that they're honest with me because I know they're in the practice of being a doctor, right? They're the practice of medicine. They're learning as I'm learning, and I feel committed to them and they feel committed to me. So thank you for giving me that example there. So I knew that was a lot, and I realized I talked probably faster than I wanted to, but let me do a quick recap just in case you joined here later. Or if I talk too fast, and you got to remember all my points. The first one was, when we think about what happens when we don't center weight, is that we can center the individual over stigma, meaning we can really think about how can we best support this individual. You can think about how can I best support myself. The second thing is we center our facts over our assumptions. That means we're looking at the actual data. We're looking at, yes, measurement and metrics, but we can also be looking at things like, how do we feel, our symptoms? We can feel looking at our energy level and making decisions based on that. Meaning like, yes, maybe you're like, well, these certain foods, really drain me. So you might avoid those things and just look at that as data. Whereas something may not be the quote unquote healthiest option, but it might be something that you genuinely enjoy and doesn't have any negative impacts on your body. Then you can keep that thing, enjoy it. And then the last thing is we center trust over compliance, meaning that overall we want to focus on building that trust with one another, building the trust as a patient, but building also the trust as a provider, versus saying someone's following your role plan and they're doing all the things they're quote unquote supposed to do. And you're like, but they're not making progress. Like that was my experience of like being on medications, not anti-medication, make that very clear, but being on medications that really weren't supportive of me, didn't really make any positive changes because of it. So I worked with my healthcare team and we came to an agreement, let's try a little bit more of a holistic approach. And we ended up being able to have a lot more progress there. So that was a great way that we were able to collaborate together. But it also helped us build trust and let them know that I'm also being compliant with your ideas, but also let's try something different to make sure we can figure out what works best for us. So that was this week's live video topic. If y'all have any other topics that you want to come up with, let us know. We are in the month of National Nutrition Month, so we're trying to make sure we create all different types of nutritional concepts and conversations, even though technically the theme is discover the power of nutrition. And we know nutrition and physical activity do go hand in hand. So we'll be having a little bit more conversations next week about physical activity as well. But thank you so much to everyone that jumped on here live. Love having y'all live. If you have any questions or are watching the recording of this, you can always drop it below or send us a direct message. But we hope to see you again next week.